Okay, so here are some of the very important questions related to neurology. 72-year-old male patient having resting tremor, bradykinesia, instability in posture. Bradykinesia, instability, these results into indicates Parkinson disease, and in Parkinson disease there is deficiency of dopamine. Now, dopamine deficiency results into Parkinson disease, substantia nigra, and pars complicata deficiency results into the Parkinson disease. Next disease is 25-year-old man patient blood, vision, limb weakness, urinary incontinence, periventricular white calcification, and white matter lesion results into periventricular lesion results in multiple sclerosis. Answer is multiple sclerosis. It occurs in the demyelination of the CNS and spaces results into periventricular lesions and blurred vision. So multiple sclerosis is the answer. Demyelination. It is autoimmune disorder. Next is which of the following finding is the base distinguished between myasthenia gravis and from Lambert-Eaton syndrome. Myasthenia gravis has antibody that is ptosis that worsens with uh, activity. Ptosis worsens with activity. Proximal muscle weakness present in the both hyporeflexia same autoimmune voltage calcium channel is in Lambert-Eaton syndrome, and then Myasthenia gravis shows fatigability and ocular muscle weakness and lower with ptosis and worsening with activity. So in this way, myasthenia gravis can be differentiated from Lambert-Eaton syndrome. Next is a patient present with a headache, neck stiffness, photophobia. LP shows xanthochroma. What's the most likely diagnosis? Xanthochroma results into subarachnoid hemorrhage because there are circle of villus in subarachnoid space, and bleeding from there results into hemorrhage, subarachnoid hemorrhage. Next one is a 60-year-old male patient, sudden painless loss of vision. Fundoscopy shows cherry red spot on the macula. Answer is central retinal artery occlusion, cherry red spot. And other is brain tumor, most commonly found in the children, is associated with the pilocytic astrocytoma. It occurs most commonly in the children. Pilocytic astrocytoma tumor, and often cystic with moral nodules, rose tail fibers. Next is a seven patient exhibit expressive aphasia and preserved comprehension, that is Broca's aphasia, expressive aphasia, broken words with expression is inability. What is the first line treatment for status epilepticus? That is lorazepam is the first line for status epilepticus. Benzodiazepine are the first line agents. Next one is a patient condition is mostly associated with onion bulb formation in peripheral nerves. Onion bulb formation is Charcot-Marie-Tooth disease. Charcot-Marie-Tooth disease. It is repetitive demyelination and remyelination leads to onion bulb formation and hereditary neuropathies. Onion bulb formation. Now this is onion bulb formation because of repetitive demyelination and remyelination. As you can see, this is onion bulb, this one is onion bulb formation. So in this way, we can diagnose histologically the onion bulb formation in Charcot-Marie-Tooth disease. Next is a 40-year-old man, history of epilepsy and intellectual disability, ash leaf spot. It is tuberous sclerosis. Facial angiofibromas are present. Ashley, if the triad of seizures, intellectual disability, and skin finding like Ashley spot and angiofibroma is in tuberous sclerosis. Tuberous sclerosis is a disease, and Ashley spots are present, in which there is triad neurological, heart, lungs, liver, skin, Ashley spots are present. So these are the typical findings of tuberous sclerosis. As you can see, these spots on the body and results in skin pigmentation and intellectual disabilities, tuberous sclerosis, and there are seizures, brain tumor results into it, actually spots like on the body, There are fingernail, toenail fibromas, facial angiofibromas, and then marks on the body results into the tuberous sclerosis. Okay, this is very important. Tuberous sclerosis, there is learning disability, seizure, facial angiofibroma, rhabdomyosarcoma, ash-leaf spots on the body, and also seizures with intellectual disability and tuberous sclerosis. So, demyelination happens in multiple sclerosis due to autoimmune damage in the brain and spinal cord, present with optic neuritis, intranuclear ophthalmoplegia, motor deficit, relapsing in periventricular Dawson finger demyelination. Next is the neuromyopathy optica. It is also autoimmune demyelination, results into tingling sensation and optic neuritis. And the next one is progressive multifocal leukoencephalopathy because of JC virus, and it is also demyelination. Central pontine myelinolysis is a rapid coordination hyponatremia, quadriplegia, locked-in syndrome, and demyelination occurs. And Charcot-Marie disease is also there is demyelination results into the same seizures. Okay, next disease is amyotrophic lateral sclerosis. It is a neurodegenerative disease present in the upper motor neuron and lower motor neuron complications. It is upper as well as lower motor neuron disease results into signs of both upper and lower. Upper motor neuron sign is spasticity, hyperreflexia, clonus, and a hyper